Hello, I'm Dr. Erickson, owner of EHS Physical Therapy and Chiropractic. Thank you so much for joining me on this video. I can't wait to inform you, educate you, help you make the best decision possible for your rehab and recovery journey. All right, I think the first thing that's important to know is that you don't have to see a primary care physician or doctor first in order to get help from a clinic for your muscle, spine, or joint pain, okay? The only reason that might come into play is if you're choosing to use your insurance, which I will cover later. Then there are certain insurance companies that do require a referral. But for right now, just know that in the state of Nebraska, it's primary care, and you can go see the clinician that you choose without any kind of referral. And then the other thing to remember is that you also don't have to go to where you're referred to, right? So you can choose to go to whatever clinic or see whatever clinician you want to. So that's why I'm going to give you this information so that you can make the best decision based off of where the location is, what kind of clinic you want to be seen, what kind of clinician you want to have help you with this problem. So just know that even though you are referred someplace, you still have the right to choose to go wherever you want to. Okay, so now which to choose, right? What's the difference? Do we go with physical therapy? Do we go with chiropractic? Those are the two most common. So let's cover physical therapy first. I'm a physical therapist by training. So really, physical therapy uses a combination of specific techniques, exercises, movements, and we help you recover from injury, from any kind of physical limitation, with the end goal, obviously, of reducing pain first, but really it's to restore that mobility and restore the movement and your functional ability to do things throughout the day. Okay. All right, so in physical therapy, we work with patients, directly, one-on-one with them, or sometimes in small groups, but really the focus or the key is identifying the root cause of the issue, not just treating the symptoms, but identifying the root cause of the symptoms. And then we develop a personalized and very customized, to you, plan of care that involves certain movements, exercises, stretches, and other activities to help you reach your goal of moving better, getting back to whatever activity or lifestyle that you want to get back to doing. So the ultimate goal of physical therapy is to help you recover from that either pain or limitation and really get back to living the best quality of life that you can. All right, let's talk more about the chiropractic side of things now. So chiropractors in general focus on the diagnosis and treatment of musculoskeletal disorders within the body, but in particular are much more focused on the spine. So chiropractors typically use more of a hands-on approach, as opposed to on the physical therapy side. We do some hands-on with some manual therapy, but also a lot of movement exercise-based things. But chiropractic will typically use hands-on techniques like manipulations, right, to move the body and move the joints to help relieve pain, improve mobility, and promote healing of those injured tissues. So the goal of chiropractic care is very similar to physical therapy, right? The goal is to improve function, decrease pain, and allow people to get back to living their life the best way they can with as minimal restrictions and pain, which is why we use them together at our clinic. We find that they play off of each other very well and really go hand in hand. There's a difference in the techniques, but the ultimate goal is the same for you, the patient. All right, so here are some clinics or some tactics or some things to be aware of in a PT or a chiropractic clinic that you really should go into, having your antenna up and thinking, okay, what's going on here? It seems a little bit strange or a little bit out of the ordinary, because frankly, a lot of places are. But if they use words like subluxations and the joints are not aligned properly, and one hip is higher than the other, or your hips are out of place, or innate healing, or that all they have to do is just fix these misalignments, and the misalignments in the spine are the cause of all kinds of health problems. Then those are ones you really need to probably stay away from and be very cautious of. So, or if they're telling you that I have low back and hip pain, but all I have to do is just adjust, or work on the upper neck, and once that's all aligned up there, everything else will be fine. That's another really red flag to probably stay away. The other thing to look for is if they get you in and have a consultation, And then at the end, there's a very hard sell process, or there's a long treatment plan that you have to commit to before you can be seen. Like, oh, we can't see you unless you commit to 3 times a week for the next 6 months. That's another you got to have that kind of light bulb go off in your head saying, wait a minute, that seems like it's kind of out of the ordinary for fixing these problems for me. A good clinic should really have a couple of choices, right? A couple of options for you to choose from. Do you want this many times a week, or do you want this many times a week? And they should also have some kind of payment plan available, so that if you do choose to, whether you use your insurance or whether you pay cash out of pocket, they have to make it affordable in the sense that you can, you're able to actually go and get the benefit of the service. The other ones to be wary of would be if you go to a PT clinic and the very first visit, right? They just assessed you, and so then they give you a packet of 10 exercises that, first off, they never even went through with you. They just give you a packet of exercises and say, do these at home. So you don't know if you're doing them correctly. They never checked and showed you how to do them. They also never assessed what the result or what the cause and effect was of you doing that. You don't even know if you're going to, that movement, for example, is going to make something worse for you because you never checked it out or tested it in the clinic. Some other things to be wary of, and I'm going to go into this a little bit deeper, a little bit more in another section, but if they won't help you, they won't assess you without even talking to you, they haven't asked you any questions, they're just saying, this is our rule, we won't help you unless we get some kind of advanced imaging, like an x-ray or an MRI. In most cases, that is not needed. They can absolutely, a good clinic, a good clinician, can absolutely assess you and help you without those. The other thing to look for is when you call or when you stop in, if you don't feel a positive energy in that place, if you really feel like they're in more of the transaction business than they are the helping people business. So if it's very, computerized, robotic, low affect, right? They don't have a lot of energy and a lot of positivity, I'd be wary of that place. Another thing, especially on the PT and chiropractic side really, is if they're doing the same treatment over and over again, right? Day 1, week 1 is just like week 3, week 5, week 6. I'm doing the same exercises. There's no progression. I already know what to do because I've done it, 15 times before that. That's another sign that they're just going through the motions. They're not really there to help you achieve the goals in a stepwise fashion of progressing as your body changes. They need to change the treatment plan as well. Okay, the last two that I would really be concerned about if you're interacting with the clinician or the clinic itself is if they're really more in the pain relief business, kind of that just transactional. Yeah, we'll see you a couple times, we'll get the pain reduced, but then they kick you out, right? They're not really in the, unless that's what you want, but it's just something that I see sometimes is, do you just want to be in the pain relief game, or do you want to be in the actual helping people live better, longer, healthier lives? That's two different kinds of treatment. Or the place that really speaks badly about other professions, right? They say, well, don't ever go there. They're terrible. They don't know what they're doing. Don't go to that. Don't go to PT. Don't go to chiro. Don't go to, your orthopedic doctor. So we all work together, but we're all trying to help, solve these problems. So the ones that really speak badly upon that, be wary of those as well. All right, so here's some other things to consider. So what kind of pain are you experiencing? What are you suffering with? Is it intermittent pain or is it constant pain? Because those are two very different kinds of things. So in general, a mechanical pain, which is what works very well for conservative care like physical therapy or chiropractic, would be considered more in that intermittent pain, right? So if I have a certain position or movement or activity, it doesn't hurt, or it at least, even if it's constant, it's very low. Like I can calm it down if I sit a certain way, if I move a certain way, if I position myself a certain way. But then I know that if I reach, if I bend, first thing in the morning, so movements, activities, time of day, postures, positions, somehow change my pain. It can either make me better or worse, depending on what I do. But those are very good kinds of pains and injuries to see a physical therapist or chiropractor, okay? So the other kind of pain would be if it's something more constant and maybe more driven by a chemical like inflammatory process or an acute injury, like let's just say you had trauma and you fell off, you fell down and hurt your wrist, you fell and hurt your ankle, you got in a car accident, you got hit by something. Those trauma type things, at least at first, are probably better to go to, to the ER or to someone that can do at least some triage and make sure that you didn't break something. So if you have a fracture or something more serious, that's not, where we would be of best help. Now we can help you in the beginning, at least go through those questions. And then if those red flags are raised, a good clinician and a good clinic will refer you out to the right place that you get the right care. But just think about what kind of pain, do I have? I've been having it for a while, it comes and goes, or it at least changes in intensity based on what I do, movement, that kind of stuff. So kind of figuring out, if it's something that's joint related, muscle, spine, or joint related, or if it's more like disease process related, right? So it's going to be more systemically or inside your body related. Is it because of like a disease process like MS or something different that needs a different kind of care? All right, another thing to think about is how long have you had it? So now that we know that, okay, my arm's been hurting, right? I get this pain in my shoulder, and it's intermittent, or at least changes with activity. How long have I had it? So acute versus chronic. If something's acute, it just happened, a few days ago. Whether I did something or not, that's important. Whether I have a reason, or if I just woke up with it, all of a sudden I couldn't turn and my arm was sore. Acute is the best time to seek care, because it's usually a lot easier to change, a little bit faster to get that problem fixed. But chronic pain over time, right, 6+ months, years of pain, can still be affected, can still be fixed with conservative care. Just understand that it's probably going to take a little bit longer, and it's probably going to take a little bit more effort and time and consistency to get those to change, because it's been so long, and body systems and tissues and things have adapted and changed over time. All right, so also, is it actively, am I getting better quickly? Am I getting worse? Or am I kind of just staying the same? So most of us will innately, like if I hurt myself, I'm gonna wait a few days, because I'm like, this will probably get better. And if it feels like it's actively getting better, like every day is getting better, I'm like, it was really hard and now I can, it's feeling a lot better. You probably don't need to come in and get much help. Or if you do choose to, it's fine, but it'll probably just the treatment plan should be very short. It shouldn't take long to fix something that's actively improving. Now, the other two, if it's staying the same or it's getting worse, those are key indicators that, okay, I better do something about this. I let myself rest a short period of time. Don't rest too long. You don't want to just do completely nothing for weeks. That will not aid you. It will not benefit you. But I let myself rest for a day or so. I've been kind of working below the level of that threshold of increasing pain, and it's just not getting better. It's been a few weeks. I'm not improving, or I'm actively or quickly worsening. I could move it up, and now I can't do anything. It's even worse. Those are indications you better get scheduled with a place that can help you right away. Okay, so let's go into the insurance side of it, right? So many of you, and hopefully you watching, you have the choice of whether you want to use your health insurance or not. It's totally fine. So if you're choosing to use your health insurance, do you understand what a deductible is, what a co-insurance is, what a copay is, what an out-of-pocket maximum is? All these things play into what the cost for you is going to be. And there are so many plans. There's thousands of plans. There's thousands of different, options. So you really have to have a place that will, provide a free benefits check. Will they help you check the benefit and help you understand what you're responsible for and what your insurance is responsible for? And will they give you an estimate so that you kind of know, okay, it's going to be about, this per visit based off of, the typical codes that you use? That would be a very helpful and important thing to ask and